Doctor, my eyes have seen the years and the slow parade of fears without crying. Now I want to understand.
Welcome back to Accent Your Beauty. You know, since we've been doing this show, we've been getting so many calls, texts, emails with your questions at home about different procedures, things that you would like to ask the doctor if you could sit down with him. So tonight's going to be kind of an online consultation for you at home, and we're going to answer some of your questions. But before we do that, Dr. Berkowitz and I are going to talk about something that's been in the news recently, and that's these vampire facials and how you better go to the right person or you'll end up either looking like a vampire, being eaten by a vampire, or wishing that you had been. Dr. Berkowitz, tell us what happened in Mexico.
So it was in New Mexico, in the United States.
Oh, it was here?
It was in the United States. And so people who received the vampire facial received a call back from the clinic that they now need to be tested for bloodborne diseases.
Bloodborne diseases like
HIV, hepatitis.
That's not good.
That's a nightmare. And it should never happen.
So how did it happen?
So the problem is, in the United States, every state regulates clinics differently. And so in some states, only the doctor can perform injections. In other states, like Michigan, you can have a nurse perform it. And there are some states where you don't even have to be a doctor or a nurse, the way the rules are written.
A facialist or someone at
An
a home party
esthetician
could do it? Yeah, that's not good.
It's terrible. And so while the FDA does not regulate the drawing of your blood, because it's your own blood, it's like regulating saliva or urine.
Yeah, another bodily fluid. However, taking it out, spinning it, and then replacing the platelets, that should be regulated.
Yeah, so they don't look at that, but they look at the machinery. So there's machinery called a centrifuge that spins. Now, when we perform the vampire facelift or facial, it's done in a centrifuge that's closed. And so your blood goes directly into a tube that cannot be put with anybody else's blood. Can't touch anybody else's blood. It's impossible for your blood to be contaminated. And so it's a very safe procedure.
Plus, you're there and there's a doctor there and it's
overseeing everything.
Controlled. Correct.
But there are, unfortunately, people who are only looking to make money off of the name. They're not,
Is that the real name, though? Is it really called the vampire facial? Is that the name?
So it is. So Dr. Charles Runnels, and he did a lot of research. So what he was looking at was there were so many different people out there who were performing fillers, and he said, you know what, there's got to be a better way. And he looked and he saw that using something called platelet-rich plasma, which is your own blood spun out in a special method that creates these platelets that then have growth factors that can be injected back. When he went to quite a bit of expense and time to formulate the correct formulation for both your blood along with fillers and injecting it. And he was the father of the vampire facial. He actually trademarked it.
Godfather of vampire facials. We'll call him Dr. Dracula.
Yeah, and so he'd probably laugh at that. And so he put on workshops and continues to, and teaches other doctors how to properly perform it. Unfortunately, because the name has become so popular, like Kleenex, people are just using that name, but they've never been taught how to perform it. They just, unfortunately, sometimes just take your own blood, spin it in an open system, and that's where blood can be contaminated.
So it's like cross-contamination.
Yeah.
And that causes all kinds of, you can either get infections as well, right?
Right, and the ironic part is platelet-rich plasma is actually used to treat and decrease inflammation. There's never been an infection from PRP. There's thousands of studies looking at platelet-rich plasma. So this is, unfortunately, some people who only were looking at how they can make a buck off of other people, not looking to help people, and in an unregulated office performing this procedure.
Well, I think people have to be very careful when they do any kind of a procedure. But specifically when you're dealing with puncturing the skin and dealing with putting your blood back in, you want someone who knows what they're doing. You should check that out the same way women check out a hairdresser, they check out an attorney when they're getting a divorce. You should check out.
They spend more time looking at who their hairdresser is than who's injecting them.
Right.
And they don't ask, what products are being used. When you're having a product injected, you should actually see it come out of the box. You should see it coming out of the box and know exactly what you're receiving. And I can't tell you the number of people who come to me after seeing other doctors and other clinics, and I ask, well, what did you have done? They have no idea of their history.
Well, then they didn't do their homework very well, because that's something you should know at all times. Now, if you don't see, I think a lot of times you go into a doctor's office and the syringe is already there filled with whatever they're putting in. You never saw the brand name. They tell you it's, let's say, Juvederm, but how do you know that that's what it is if you don't see it come out of that box?
So a few things. I mean, number one, when I inject, I always have the boxes there, and I take them out at the time.
Perfect. That's the way
so
it
they
should
can
be.
see. With Botox, because Botox can be used and really has to be reconstituted beforehand, we keep the bottle and the box still there with the syringes too. So people can look, they can see when it is, and we write the date and who reconstituted it as well. So everything is known about every injectable that we do.
Well, that brings up a question I always wondered is, let's say I come to you and I want, let's say Juvederm, that's what we're talking about.
Sure.
And we use up one syringe and we go into the second syringe, but we don't use all of it. Can that be stored and saved so I can use it the next time?
Once it's open, it's like a sugar, and bacteria love it. And so once it's open, it's prone to be like a petri dish.
Okay.
And so it can't be shared. It can't be saved for later.
So you can't bring in a friend and each share a syringe?
No.
Of,
It can't be done that way.
the product is for one person and one time only use?
Correct. But one syringe is 1/5 of a teaspoon. And usually, let's say somebody's coming in for their lips and they need one, syringe within their lips itself. I can always find an area that they're going to find very natural and beautiful and youthful by
It doesn't get
placing.
wasted then.
It will not get
There's
wasted.
always a place.
There's always a place.
And when they hold up that magnifying mirror and say, what do you see? You'll find a place to put it.
There's always a place for injectable.
That's for sure.
So the vampire facial, to give you a little idea, what it does. So basically, as you said before, it is Juvederm normally, which is the most popular filler made by Allergan, along with your own blood. And so the filler is used to create volume, while the platelet-rich plasma, the vampire part of it, that is there to improve texture of the skin, to help in the healing, and can be used to fill as well. And that's different, in a vampire facelift, where we usually use more filler. In the facial, it's actually placed more upon the skin to improve the skin, maybe done along with microneedling as well, to help channel and to place the both the filler as well as the platelets into the skin. When somebody buys a product with growth hormone that they're putting onto their skin, they're basically just one factor is placed. What people don't realize is your own blood has so many more of these factors. So when you're getting it injected, the goodness that is there far exceeds anything topical that's out there that is made by the industry. And there's some great products that I love.
Not to interrupt, but explain with the vampire facial. Now, they're injecting the blood, your own blood, mixed with Juvederm. See, I didn't know that that's part of the components that go back into your face.
So with it, you can do a few different things. You can, if you're just doing the facial, you can place just the PRP or the platelet-rich plasma onto the skin with channels. There's actually a way to microneedle now too, where you can inject small amounts of Juvederm into the skin simultaneously. You can even do a little bit of Botox, so we can make a mixture up and place it into the skin as a mixture.
It's like a little cocktail.
A little cocktail.
And you can a little more of this and a little less of that, depending on what the person
person's
needs.
looking for.
So is this mixture
Go ahead.
Filler goes in, but after I see people with the vampire facial, it looks like they have blood on their face.
So they do have blood on their face depending upon the depth of the microneedling. So microneedling can be placed where you're going like 0.5 or 0.6 millimeters, where for that you may get a little bit of spotting, or I can go much deeper and do microneedling even in the operating room where I'm going 1.4 millimeters, and I am creating these little channels that create bleeding. For the majority of people, the next day, their skin is already looking great. And
So the blood that you see on their face wasn't put there, it's what came out when it was needled in.
correct.
I always thought they splashed the blood on the outside of the
Yeah.
face, but it's coming,
Because
it's your
actually-
own natural bleeding.
That's correct, because when we spin out your blood and get that platelets, it actually is no longer red. It's more of a clearish yellow solution that's placed upon the skin. And so when the microchannels are made, it's your actual skin bleeding, and then we're placing this to go into the channels. And there's only a select amount of time that the PRP can get into these channels. And studies show it's minimally 30 minutes, and some people believe up to 24 hours where you can get these cosmeceuticals into the skin. But I think it's more around the 30-minute mark.
So when you see the blood, that's the blood that's coming out of the needle, Mark.
Correct.
So you don't wipe it off as you go along.
No,
Yes.
I actually leave that on because your own blood has healing factors and a cascade within it to help in the healing. So we want that to be part of the healing process to help build the collagen for you and help create.
So how do you
rejuvenated skin.
see where to do the needling when it's just all blood?
So it's not that bad. So
Okay.
unfortunately, when Kim Kardashian had it performed, she did not look great afterwards because I think they went a little bit deeper than she needed. Most people, it doesn't look like a car wreck.
Okay, so there might be little dots here and there of
Correct.
blood, but your whole face doesn't look like you just went through a windshield.
No, for the normal PRP that people are going through with microneedling, you may see a few little dots here or there, but it's not this bleeding that you look and say, my God, what just happened to them? Now, can we go that deep? We can, and for certain people, we do go that deep, but they're well aware of that, and they need a little bit more downtime. But usually it's within 24, 48 hours that, they were in makeup already.
How would you compare it to a light peel? What's the difference between a peel, a resurfacing, and a vampire
So it's a great
facial?
question. So, with peels, we can go to different levels. So we can use glycolics where we're doing a lighter peel. There are deeper glycolics too, salicylics. And then there are even deeper peels like phenol peels that can go quite deep and make tremendous changes. So the vampire facial, I would say, is equal to like a deep glycolic peel. And the beauty is that you can see exactly where you're placing. With a glycolic peel, sometimes it can go deeper than you'd like, or maybe too superficial. And I actually like the vampire better because I know the depth I'm going to. Plus, I'm putting in the healing factors as well. So I think the person gets more of a peaches and cream kind of look to their skin a little bit faster.
What's the price comparison? Like how much is the vampire facial and how much is the peel you were talking about,
So-
the resurfacing?
So the peels can run anywhere between a home peel that we're sending you home with can run a few dollars to one that you're doing in the office that can be a few $100s, depending on the depth we're going to. A vampire facial runs several $100s to just over $1,000, depending if we're using filler along with it too, or if we're doing a vampire facelift and placing even more filler as well. But there's more benefit to the vampire.
Okay, question.
Go ahead.
Which one is there more downtime or less downtime? Because a lot of people think if they work about the same, which one am I going to look better the next day and go back to work?
Yeah, so we can customize it. So there are peels that we can do where you have it performed and you can go back to work and be in makeup the next day. With a vampire facial, I'd want you to have 24 hours available.
So stay home the whole next day.
Yeah, I'd like
But
you to
then
have
the
20
day after you can apply
you should be
makeup
able-
and go
yeah,
to work.
Yeah, for the majority of people.
Okay, well I hope that answered the questions about whether or not you're going to get HIV getting a vampire facial. Not in Michigan and not with Dr. Berkowitz. So, should we get to some of our questions? Because we have, look at them all. We have a lot of questions, which means a lot of people have been watching and have questions for us, so I like that.
But before we do, I'd like to say, so as far as this book is concerned, so first of all, you can come on in and I'm there to educate, whether you choose me or not, and I hope you do. I'm there to educate. But part of the questions that people have, if they want this book, they just let us know, come in, and they can take this book home, read through it. And when people read through this book, they come right back in for the vampire facial. And so it's quite an interesting read.
I'm taking it home tonight and read
You
it.
can.
Leave it right there. I'm taking it home with me. Before we get to the questions, I just want to say that I intend to have everything we're talking about so that I can tell you about it. So before we get started on the questions, I want to talk a little bit about that Hydra Facial that we spoke about in an earlier show. So I went in and had this done, and I have to say it was the best facial I have ever had. They start out by cleaning the skin, almost like sucking. They suck off layers and exfoliate. Felt wonderful, just like this big vacuum.
Cat's tongue.
It was wonderful. Then they used like a microdermabrasion with crystals and cleaned everything out, took off a top layer. Then I think the third step was they sucked out blackheads and whiteheads that I didn't even know I had. And they sucked them all out. And the best part was at the end, you could see what was sucked out of your skin. You could actually
look into the jar and see everything.
And see all the tiny little blackheads floating around, hopefully not too many. And then they finish up with serums and different
and the serums could be customized.
Yes, depending if you have dry skin or
correct.
oily skin or whatever. And then at the end, you can have a skin analysis done where they will tell you exactly the condition of your skin. But I have to say, it was the most wonderful facial. It was probably a half hour, 40 minutes, and I left there and I looked like a new baby.
Yeah, I mean,
Just
your skin
beautiful
feels great.
It did. It felt great. Everybody was touching my skin and saying, "What did you do?" I didn't even need makeup. That's how great it was. So I would recommend that to anyone. And next I'm going to get a vampire treatment and get that facial, and I'll tell you about that one. So when we come back, we're going to get to our questions. We'll be right back.
Low budget movie version.
60s TV version. Early 2000s high school pseudo-adaptation that eventually grows into the geek we all know and love version here. I'm getting paid a lot of money to be here, so listen up. Watch the Geektainment channel on newradiomedia.com. It's geek approved. It's all about you, and that's the way we like it.
Where you're going,
What you do to stay fit.
what you're eating,
what you're thinking,
and how you're feeling. Join the conversation at newradiomedia.com's Lifestyles channel.
stream the life you want to live.
Detroit. It's the home of some of the world's most talented artists. It's where techno and Motown were born. It's a city where you can experience raw, untamed rock and roll. I'm Ben Rose, and I'm inviting you to join me weekday afternoons from 4 to 5 for the Motor City Juke Joint. I'll have interviews with musicians, info on what's going on around town, and a playlist curated by me just for you. It's all right here on newradiomedia.com.
Do you want to see things like this?
Did you just say you died?
Well, I mean, technically.
Or maybe even something like this.
We'll do nothing but destroy your corpses and burn them all for my dogs.
Your dogs are gone. And sometimes, a little of this.
We need to have a talk.
I take my axe and I smash it.
No!
And check out Podquesters, the show where we tackle ghoulish goblins, fiendish foes, and dangerous drakes.
Oh, like the singer?
No, the dragon creature. Anyways, Podquesters, Fridays, only on newradiomedia.com.
Okay, we're back with some of your questions, and there's some good ones here, Doc.
All
So I
right.
hope you're ready to answer all these, because
All right.
I want to know the answers too, because some of these kind of apply to me as well. But this is a friend of mine here in West Bloomfield who wants to know if she does Juvederm for the eye hollowness, underneath the eyes, before she goes in and has that laser, the ablative laser, is that going to affect the Juvederm? So which should go first?
Okay, so as far as that's concerned, number one, the laser does not go as deep as the Juvederm is placed. So it's not going to hurt the Juvederm. But my bigger question for her is, why is she allowing Juvederm to be placed in her lower lids? Juvederm is a great filler for the lips because it loves water. And so it creates a luscious lip. But the lower lid is the thinnest skin in the body.
Well, I don't think she meant the eyelid. I think she meant,
the
is that
low-
a lid underneath?
Yeah,
Does
so
that
this is
your-
the lower lid.
Okay.
And so she was saying like the tear trough
Yeah,
area.
that little hollow
And
area
so
that we
little
all
hollow-
get.
Juvederm's not the best filler for that area because it will take on fluid and
Oh, so
then
it might get puffy looking.
might get puffy. Plus, it can create this effect called the Tyndall effect. The Tyndall effect's a bluish discoloration.
Okay,
to the
we don't
lower
want
lid.
that one.
So
we don't
but
want to
there-
do that.
But there are better fillers. So there's a filler called Bellatero that can be used
I've
there.
heard about that one.
Your own body fat can be used there. Volbella can be used there. They're made
Is
for
there one
that area.
called Voluma too?
So Voluma is a perfect filler for the cheeks.
Okay.
So Voluma and Volbella and Juvederm, they're all cousins, all made by Allergan, and they all have their specific areas to go. So for your friend, what I would say is, let's not place Juvederm. Let's place something a little bit softer, and like Bellatero Volbella, and don't worry about doing the laser. It could be done before or after, but if she were my friend, I would do the laser first.
Oh, you would do the laser
I would do the laser first because...
See how you like that result.
Right, because you're going to get tightening in that junction between the lower lid and the cheek, and it may be enough that you can avoid filler altogether in the lower lid area.
Well, I'm glad she asked me that because she was going to go ahead, get the filler, and then do the laser. So that probably wouldn't have given her the result she wants.
Probably not giving her the exact result, especially if she used Juvederm. And Juvederm's a great filler.
In the right places.
In the right places.
So what, and again, I always ask price because everyone asks me price. So to do the laser is about how much?
So depending on how deep we go, some of the lasers that are not as deep, like a fractional laser, can run between $800 and $1,400 per treatment. If we're going deep and I'm going into the operating room, it can run between $3,500 and up to $7,000 or $8,000, depending upon the laser that I'm using for them.
And why do you need both? If you're spending $5,000, why do you need to put any filler in after?
Well, it depends. So certain lasers, like we spoke in the past about one called Renuvion, which used to be known as J-Plasma. That one not only tightens skin, but seems to plump the skin as well. And so that one you can get close to, for some people, almost the look of a facelift, a natural looking facelift, not a windswept facelift,
right,
with skin tightening at the same time. And so you may not need filler. And that's why I say, let's do resurfacing first for you. Let's go through the healing period, and then if you need filler, we can always place it. But if somebody came into me and they already had filler and now they want to have resurfacing, they don't have to worry about that filler disappearing.
Oh, really?
Yeah.
That makes it last longer?
Well, it's not that it lasts longer, it's that the filler is at a deeper level than the laser goes.
Okay.
So it's not going to melt that filler.
That's a good thing to know because I think that you should talk to, you know, the doctor and who's sitting right here and ask him, do you need both? Because some patients probably don't need as deep.
Well,
so
what ends up happening is people will see things on TV or the internet and they'll come in and saying, I want X, Y, and Z. And they're positive that it's only X, Y, and Z that's going to make the change for them. And that's why our consultation is so important, because we point out for them a plan and they can choose 1, 2, 3, X,
maybe
Y,
they
Z.
don't
but
need X, Y, and Z. Maybe
correct. It might
X
be the
and
worst.
Y will be
right.
just enough.
Enough for them. Or it's A, B, C, and X, Y, Z would have been a problem for them.
Okay, my next question, I don't know the person because it came in emailed, they didn't sign the name, but they want to know, is neck liposuction possible when you're obese. Like if you're already a very heavy person, but you don't want that double chin, can you do that on just the chin and look better?
It's always best with any facial procedure to be at an ideal weight, okay? But very few of us are at an ideal weight. So we have to take a look at their BMI, we have to take which is their body mass index, we have to take a look at their age, we have to take a look at how they're wearing that weight, if you will. So some people can wear extra weight better than others. So can they have a procedure like liposuction underneath the chin? The answer is yes. But if we're not getting skin tightening at the same time, so we're just removing fat, they may have excess skin in that area too.
So now instead of a double chin, they have the turkey neck.
They can have a turkey
They have the
neck.
little wobble thing hanging there.
So we have to make sure that, number one, if we're removing fat, is there a skin turgor enough that it will snap back, or do we have to do something else like use a laser underneath the skin to help tighten the skin for them? Or is it really that they need a facelift? Because sometimes that fullness is related to a muscle called the platysma that starts here and ends here, and that platysma basically needs to be tightened too. So without seeing this person, it's impossible to say yes or no, but the answer is a definite maybe, that it can be done for them and we can remove fatty tissue, but we have to see if it's the right process for them.
Yeah, because you don't want to fix one problem and create another problem. So now we remove the fat, now you've got all this hanging skin.
Correct.
So you could have fixed both by just a lower facelift.
If that's what they need, or some lasers can be used to tighten the skin simultaneously. And you know, when somebody says obese, their BMI may be 30, 31, and while that's considered obese, they may still be an excellent candidate just for neck liposuction.
Well, it's good to know because you want to know what your options are. Okay, this one here was a text to me, and they want to know if the radio frequency, now this doesn't make sense to me, but on the forehead, is it the same as a brow lift? If you get that radio frequency on your forehead, will that tighten it and lift?
So radio frequency, one of the first procedures that came out is one called thermage that can be used to tighten the skin. And there are many different types of radio frequency now. The brow is actually very heavy for most people. And so just using things like radio frequency can get tightening of the skin, but it may not be enough to lift the brow as well. When we resurface the forehead by using like a CO2 laser or the J plasma, the Renuvion, you can get even more skin tightening and get a lift. Radio frequency on its own, for most people, will probably not lift their brow enough to equal a brow lift. But
well, let's introduce Botox to this
go
equation.
Ahead. Perfect.
Because Botox can lift the brow and it can smooth the forehead.
Correct.
So are some people better candidates for Botox
So
than the radio
the
frequency?
beauty of Botox is what Botox does, it's a purified protein that stops muscles from squeezing. We're not trying to paralyze muscles. We still want people to make facial expression. So the reason that the brow lifts with Botox is that we're taking the muscles that pull the brow down. So in the area over here and here, these muscles are responsible for pulling the brow down. If we weaken them, then this whole muscle called the frontalis, it's responsible for lifting the brow. So it can take over and it lifts the brow, and it gives a natural brow lift by reducing the downward pull of the muscles in here. So getting rid of the 11 lines, the Kybella lines, the crow's feet from the orbicularis, you relax those muscles that pull down, and then the brow pulls up. Now, if that's done prior to a procedure like radio frequency, then what you're doing is you're making it that the muscles are not pulling down, and you're getting the tightening, so you get a nicer change by using Botox before a procedure like radio frequency or CO2 laser than if you did not do it. So Botox is really beautiful in conjunction with other procedures.
Again, it's a mixture of what works for you. It's that whole X, Y, Z. Do I need X, Y, and Z, or can I do X and Z and maybe not do Y?
I tell people all the time, you know, sometimes 1 + 1 + 1 doesn't equal 3. It can equal 7 or 8 in regard to the changes it makes for you. So procedures can be additive. And so we find what works best in the person's budget for them as well, and their downtime to make the changes they're looking for.
That's another thing that I'm going to bring up now, because I think we discussed this on a previous show, but for anyone that didn't see it, this one came in to me, and it's from a friend of one of my grandsons, and he's a teenage boy and wants to know what's the best treatment to reduce acne scarring when you've got, you know, you want to look good, you're dating, you don't want those deep little acne scars.
So it's, again, it's the 1 + 1 + 1, especially with acne scarring. It's multiple modalities. So there are many things that need to be done to decrease the scarring that's there. One is there's a filler, Bellafill. Bellafill is the only FDA-approved filler for acne scars. It's made actually for an acne scar called a rolling scar, and that's where you take your fingers over the scar and you lift up and it rolls away. And so that scar is what the FDA gave approval for, but as physicians, we can use it for other scars too. And what it helps to do is build your own collagen within the scar itself. But when I'm placing something like Bellafill, there's usually scar tissue not just within that acne scar, but underneath there's like a fiber pulling down too. So I do something called subcision, and what that is it's actually breaking those bands or releasing those bands so that the scar is not pulling as much. And so that can be done at the same time as Bellafill's placed within the direct scar. And most of the time people have scars in their cheek area and they lose volume because of that. So we place that volume at the same time.
And Ken, before we go to break,
go ahead.
I want to ask you, can you also do a light resurfacing or a light peel for that?
Yes, so that's another part of the equation is a peel. And what we spoke about before, the vampire facial
will help acne?
Will help acne as well.
There you go. We're giving you all these great tips. This is like a free consultation. So when we come back, I have some more questions that have come in, and we'll get you those answers. We'll be right back.
As a business owner, you're always looking to save money and cut costs where you can. And if you advertise on radio or television, you know it can get pretty pricey. If radio and TV aren't delivering like they promised, and you're looking for a more reasonably priced way to get your message to the masses, I've got an answer for you. New Radio Media. With live streaming and on-demand programming, your message can be seen throughout the day, and you can worry a little less about cutting those costs. For more information, go to newradiomedia.com or call Buzz Van Houten at 248-939-9999.
Hey, you guys, it's Raphael of the Teenage Mutant Ninja Turtles. Guess what? The only thing we can get down here in the sewer is Geektainment Weekly on New Radio Media. Turtle Power!
It's all about you, and that's the way we like it.
Where you're going.
What you do to stay fit.
What you're eating.
What you're thinking.
And how you're feeling. Join the conversation at newradiomedia.com's Lifestyles channel.
Stream the life you want to live.
Doctor, my eyes have seen the years and the slow parade of fears without crying.
I'm so glad to be back answering these questions because while we were during break, I got one more texted on my phone, so I hope we'll have a chance to get to that one. But in the meantime, can you get a hair restoration procedure if you're pregnant? Now, this one tricked me because it came into your office, and a hair replacement while you're pregnant means it's a woman that's asking this question, not a guy.
And
so
around 15 to 20% of our hair transplants are women coming in. And it's devastating for both sexes, but you know, for women, it's particularly devastating. I mean, the majority of women, when they come in, they're extremely emotional over the hair loss. And so with pregnancy, there's hormonal changes that can occur to cause the hair loss. And many times, once the pregnancy is over or they're finished as far as breastfeeding is concerned, because that hormonally can change things too, they can regain the hair growth. So it's not the time to do a hair transplant during pregnancy. Plus, you don't want to do it during pregnancy because we've got to freeze the area. We're going to use medications to make you comfortable, and we don't want it to affect the baby. Yeah, so it's not good for you, it's not good for the baby. Theoretically, can it be done? Yes, but I wouldn't perform it for you, and I can't think of a doctor who would do it.
That's why it was sort of looked to me like kind of a trick question, because it seemed to me that mostly women that have hair loss, it might come a little bit later in life, not as young as a 25-year-old girl having a child. So that seemed like either the person that was having the hair loss was older having a child, or if it's the younger person. I lost hair when I had my second child, and I panicked. You know, I went right to the dermatologist and I said, "What's happening here? It's falling out." And he said, "Give it 6 months, it'll regrow." And it did. By the time the 1-year birthday party came, it was all fine again.
Yeah, it would be shameful to perform a hair transplant on a woman who's 5 months out. And you were saying with young women, so the other time young women end up losing hair is a lot of times they place traction on the hair, especially certain ethnicities will braid their hair very tight. And if they don't let go of the braid in a certain amount of time, you're pulling and you're reducing blood flow, and you can create scar tissue with this. And so we see a lot of young African American women who have lost hair because of that traction that they're placing. So that's something that is devastating. It's devastating to them, and so you have to release those braids. It's so important.
I think we talked about this on a previous show also, about even ponytails, if they're too tight, you wear a ponytail every single day. First of all, if you don't use the right kind of tie, if it's like a rubber band, it could cause breakage where you make the ponytail, so that when you let your hair down, you can see that little breakage line. Or it can seriously pull the hair out, correct?
Pull the hair out, and again, just the traction can decrease the blood flow as well. So, I mean, ponytails are cute, but you've got to, let go. But we're talking really those, especially those tight braids.
What about French braiding, which is kind of a more of a looser form?
Yeah, it's a looser. That should be fine.
That's okay.
It shouldn't cause any problems. And unfortunately, there is a psychological condition found mostly in women where, and especially young women, that they pull their hair out and they start pulling their hair, especially at nighttime.
I have a friend, now that you mentioned that, whose daughter is going through a lot of psychological drama, divorce, problems at school, and she started pulling hair. She's actually created a bald spot in one particular area over her ear from just pulling, and I don't think she's aware of it. She'll be watching TV, twirling it, pulling, twirling, pulling.
And it's not just their hair. They pull at their eyebrows, their eyelashes as well. So it can be devastating, and they do it usually at nighttime, and it's something that they need help from many times a therapist to help stop that.
And we didn't even get to the issue of alopecia, which can be stress induced as well as physiological, right?
Correct.
I mean, you can actually cause yourself to lose hair just from worry and stress.
From the buildup of cortisone within your body. So there are, as we spoke in the past, a lot of different reasons that people lose hair, but again, if it's during pregnancy, that's not the time to.
Okay, so if you're pregnant and losing hair, bear with it. It will get better most of the time. Okay, now we have a question. Which technique is better for a facelift? Which particular technique? Because there's so many different kinds of facelifts. There's upper facelifts and lower facelifts, and there's the threading kind, and believe me, there's choices. Do you individualize it to the person?
Oh, it's always customized, but the first thing that you brought up is most important, and that is what the client thinks a facelift is and what the doctor thinks a facelift is. So many clients think a facelift is basically everything from neck to hairline, from a brow lift to eyelid surgery to lifting the cheeks to the jawline to the neck. When a doctor thinks of a facelift, we think of a lower facelift, meaning tightening along the jawline and tightening underneath the chin. It's not including the eyelids, it's not including the brow, although these things could be done at the same time.
But it's kind of like a Chinese, not to be facetious, but it's like a Chinese menu. There's column A, B, and C.
There is.
And if you're going to just do the lower facelift, you can always add on the eyes. You can add on endoscopic mid-facelift, which is good for the cheek area, and the brow lift, of course, which lifts the brows. So there's the brows, the eyes, the cheeks, and the lower face.
The beauty of doing these things all at one time, it's one healing period. Because if you just, let's say, did a facelift and you didn't do the eyelids, you need, depending upon the type of facelift, somewhere between 7 and 14 days before you can go out in makeup. If you just did eyelid surgery, you need 7 to 10 days before you can go out. If you just did neck liposuction, you know, alone, you may need 3 or 4 days time. And so if you can do it all during the same healing period, again, it's 1 + 1 + 1 doesn't equal 3. It can equal 7 or 8 or 9 or 10 in regard to the changes it can make for you.
So it's like one-stop shopping.
Right.
You know,
So
you're
it's
getting everything at one time, and you're going to heal all at one time, and then you're done for 10, 15 years.
So to ask, you know, which is the best facelift, it depends upon the person. So feather lifts, or basically using a stitch to lift the area, so they were popular around 15, 20 years ago. Then they fell out of popularity. Now they've become popular again. What people need to know about them is that a stitch can only lift so much on its own. And so what ends up happening with these feather lifts are multiple stitches of what's called a barbed stitch is placed. So the stitch actually catches underneath the skin and catches the muscle, so it can
But
lift.
sometimes don't they show through? You can see.
So that was a bigger problem with some of the older ones that are out there. The newer ones, is rare that occurs. But what people have to understand is that it's something that lasts them a year or 2 at most for the placement of these stitches alone. And for some people, that's fine. You know, just like filler, you say, okay, you know, I want something that's just a year or 2. I'm not looking for something that's, you know, 5, 10, or 15 years time.
So it's just a little maintenance in between a full facelift. You might want just a little.
You might want that, or if you're younger and not ready for a facelift, it may be a good procedure. But unfortunately, again, there are clinics that are out there where they end up performing this for everybody. And it's not the right procedure. And that's why I say my team and I, we're not cookie cutters. We look at the individual and we customize for them. And so for one person, you know, because of their budget, because of their timing, because of their age, because of their laxity, a suture lift may be enough.
Now, I want to say, when this person asks, what technique do you use? Do you always cut around the front of the ear for the lower facelift? Is that the technique every doctor uses? That's where you pull from?
So normally the pull is not just a skin pull, but that's actually more of an access point, if you will. Because if you just
muscles?
Right, because if you're just tightening skin, you may look nice for maybe 6 months because of swelling that's there. But what has to be done is you're making that access point so that you can tighten the muscle underneath.
Well, that's important for underneath, because I know the platysma has to be tightened. It's like a canvas. It's like a sling, isn't it?
It's a sling, and you can tighten that
chin.
sling. And so that sling can be tightened again by stitches placed in between it, and going back and forth like a trampoline, or stitches going back and forth along the jawline, or even from, again, the incision here, pulling it. And so there's a lot of different ways to tighten that platysma muscle.
Now, for girls who have longer hair, you don't see that. But what about the short-haired girls or men? How do you make sure that that line isn't a dead giveaway? Because that line I've seen on people, be sitting next to them, and I know for sure they had a facelift.
Years ago, in Michigan it was founded, there was a procedure called the lifestyle lift. And the lifestyle lift, people would have, and it was a fast procedure. People would get back to their activities quick as well. But what happened with many of these people is that the incision wasn't hidden. So the doctor would just make a quick incision in front of the ear, behind the ear, tighten skin, tighten muscle quickly, and then suture things back up and send them on their way. But what would happen is this would pull and would leave a scar line for them.
Or it affects the lobe.
It affects the
Their
lobe. The lobe
is
gets pulled down.
pixelated. Is
That's
that
correct. It becomes
yeah.
a pixelated ear.
Right. I've
And
seen
it gets
that
pulled
too.
down.
Not attractive.
And so when I'm performing a facelift, I take almost an hour just to hide the incision itself. So where these doctors were performing the procedure in an hour, the whole thing, I'm taking an hour just to hide it. And so I follow the natural curves of the ear.
Do you go a little inside?
You
so
go a
it
little
doesn't
inside the
show
ear.
on
That's
the
correct.
outside?
Yeah. So you have to go at those angles, and there are certain tricks that you learn over time to hide the incision. So I invite everyone to go to my website, come in, take a look at the pictures of the facelifts. It's near impossible
to see
the incision.
Because I've seen especially people of color, African American women or Hispanic women or Arabic women who keloid, because of thicker skin. A very thin line on them might be ropey looking because of the way they heal.
And it's not just women of color and ethnicities. We see Caucasian women as well, that if the site is not closed correctly and there's tension on it, the scar enlarges and it can raise up as well. It can become a hypertrophic scar. And I'm sure there are a lot of hairdressers out there that see it on a daily basis. And if they do, it's something that I can fix for people.
All right, so another question about the scarring procedure is when you do the lower facelift, do you also go under the chin and make an incision
So
there?
I always do. So the incision may be a tiny incision where I'm just doing liposuction. Even if somebody doesn't have a lot of fatty tissue, then I'm using the liposuction cannula to basically separate the skin so the skin can be tightened. So basically I'm taking this whole area and smoothing it out, because when I'm bringing the skin tighter this way, I want this skin to be part of that, and so I want to loosen that skin as well. So even if I'm not removing fat through this tiny incision, I'm at least loosening the skin so the skin can then be tightened through the facelift.
And again, it's about symmetry and balance so that you look even. And again, when we were talking about a facelift sectionally, like just the lower facelift or just the eyes, it doesn't look quite right when you have real tight, firm eyes and a sagging jowl, or vice versa. If you have a lower facelift but you've got bags and hanging lids, it still doesn't look like a facelift.
Well, I always
it throws
think
it all off.
The person who has a couch that's falling apart and says to the upholsterer, just fix that one pillow. So they've got this one nice looking pillow, and it's because their eye was caught by the pillow. And that's why when somebody comes in, we look together in the mirror to look at the entire face. They may not be ready for that, but it's important for them to look at it so they understand why, if they're here in regard to their eyelids, I'm talking about their cheek as well. Because they're a continuum. And so, yes, many times procedures can be done in isolation, but you need to at least know how the cheek affects the eyelid, and how the eyelid affects the brow, and how the cheek affects the lips.
You want that balance of overall rested look without tired eyes and a tight jowl. My other question is, again with technique, is if someone's previously had a facelift when they were in their 40s or 50s, and now they're in their 60s or 70s, do you go in that same incision, or if that incision was not a great one, do you create a new one?
I create a new one and try to hide the old incision. And so usually there's enough laxity from 10 or 15, 20 years ago where it's not going to look afterwards as if they have two separate incisions. There'll be, one. But again, the way I do it, it should be very hard to see the incision.
Okay, well now at least we know what we're dealing with technique. And when we get back, I guess that there was some footage, some outtakes from one of our last shows that we didn't have enough time to get on. And I think it's pretty interesting. So we're going to throw that on for you to see before we say goodnight. So we'll be right back with that.
What's going on in your neighborhood?
They say it takes a village.
It's the simple things.
The things that are a testament to the old.
And the things that are a testament to the new.
Know what's going on in your community.
Check out our community channel on newradiomedia.com.
Advertising your business these days can be challenging. Traditional radio and TV ads are expensive and, frankly, a bit of a crapshoot. Not to mention, the audience for over-the-air material is shrinking as more and more of us demand to see and hear what we want, when we want. Advertising on New Radio Media is a solution. With our live streaming programs that are also available on demand, your message is always ready when your customers are ready to watch and listen, all for a fraction of what you'd likely have been paying for other ads. NewRadioMedia.com. Call Buzz Van Houten at 248-939-9999 for more information.
Do you want to see things like this?
Did you just say you died?
Well, I mean, technically.
Or maybe even something like this.
We'll do nothing but destroy your corpses and burn them all for my dogs.
Your dogs are gone.
And sometimes, a little of this.
We need to have a talk.
I take my axe and I smash it.
No!
And check out Podquesters, the show where we tackle ghoulish goblins, fiendish foes, and dangerous drakes.
Oh, like the singer?
No, the dragon creature. Anyways, Podquesters, Fridays, only on newradiomedia.com.
Accent your beauty. That's what we're here for. We're here to accent your natural beauty and give you the look that you really want to have. Dr. Berkowitz, our guru of facial, how should we say it? Facial corrections, augmentation, improvement, all the above, enhancement. He's out of the country, so we're kind of taking the wheel here and driving our own little machine this week. So Sylvia, you're the person that does a lot of the injectables with the doctor, correct?
Correct.
So when somebody comes in and they want any kind of Botox, lip filler, any kind of filling in the lines, whatever, they go to you and you analyze them and you say, okay, we're going to put a little here, a little there, and you fill their face till they look plump and good. Youthful, right. Now, what's Kybella? Because isn't that a procedure that you can use for tightening the neck?
So Kybella is actually for reduction of fats of the submental area or the double chin.
Okay.
It's a product. It's an injection. It's a deoxycholic acid. You inject it into the fatty tissue.
It's 10 milligrams of that?
Yeah, 10 milligrams per vial, but typically one session is two vials. And just based on our patient results and just the protocol and the studies, the majority of people require 2 treatments, and they're done a month apart.
Okay.
But we just we inject into the fatty tissue of the under the chin, and then it just breaks down the fats, and then your body flushes out the fats.
Okay, what's the on a scale of 1 to 10? What's the pain ratio there for most people? I know it differs.
Right. So there's no numbing agent involved. We just have the patient ice the area that we're going to inject. The needles that we use are very tiny, but the product itself tends to sting as it's working, as I'm working. So the discomfort level is pretty low, and it really is just about that stinging from the product.
Are you familiar with something called Fractora?
Actually, I'm not.
Okay, because that is a similar kind of a thing, but it's got a piece of equipment that's got lots of little needles in it, and they push those needles all around your neck like this and this and this and this. It's not the most pleasant thing, so I'm just curious.
Yeah, the discomfort is really just the stinging of the product.
Okay. It's not even a stinging. Actually, it's more of like a burning, like a heat almost.
So Josh, we've
How long does
treated
it
him
last, that burning feeling?
Just while you're injecting.
While injecting. Right afterwards,
okay.
there's no discomfort.
Yeah.
We still have the patient ice afterwards just for swelling purposes,
right.
but not for discomfort.
So 2 treatments a month apart should really make a significant difference. Okay, I see that right there.
Right,
The
it's at least 2. Some people may require more, but
how much is it per treatment?
So we package it as 2.
The 2 treatments a month
and
apart.
It's $2,400.
Okay, so it's roughly $1,200 a piece. You know, with a month break in between.
Correct.
And is there any kind of a guarantee with it that if you don't get results, then you get your money back or part of it back, or a third treatment or something?
Patients are happy with the results. patients who may require more than 2, I'd be able to tell during our consultation. So I do let them know that they may require more than 2.
Okay.
But
now, do you get a break on the third one if you
price
end
break?
up price-wise? Do you end
we
up,
can still package it that way.
yeah, good,
exactly.
Because I'm trying to think of how to make it affordable, so everybody with double chins can get rid of. Triple chins probably take a little bit more than double chins.
Correct. So we let them know that. And then also a good thing to know about this is because your body's flushing out these fat cells, it doesn't happen overnight. It takes our bodies about 3 to 4 months to fully get rid of all those fat cells that the product damaged. So your optimal results you'll see at that point 3 to 4 months after.
Okay, so you can't go in and go out and say, wow, what a difference.
No.
So it's going to take time.
Correct. And there's a lot of swelling involved, so I always tell patients not to do the procedure, have it done before an event or before work.
Well, we talked about that before. Never do any procedure the day before a wedding or an event.
Yes.
Unlikely that you're going to look perfect the next day.
I did my first time. We
Okay,
did
you did?
Kybella.
He's done. What did you do?
I did. So it's no secret. I have always struggled with my double chin. It's ridiculous. And as soon as we got Kybella in, I was like, Sylvia, we have to do this. I have to do this. I had a wedding the very next day, and I already knew the risks going into it, but, you know, I mean, I'm me. I'm going to do what I want to do anyways. And she's like, Josh, I don't think it's a good idea. And I said, do it. So she injected me, and immediately after, you start to get swelling. And for the first, like maybe 3-4 days.
The first 72 hours typically.
They call it the bullfrog. Because what happens is this whole area starts to swell.
Yep.
Oh no,
Jackie,
you
I'm
did
not kidding
listen.
you. I was at a wedding
listen.
full of people. I have no idea.
They thought you had mumps or something?
I'm like, this.
Oh,
the entire time. I looked ridiculous. And
did you wear a turtleneck?
I didn't wear a turtleneck. I should have.
wedding?
But like every time I turned my head, like I could just feel it move. It was awful. I don't know what I was thinking.
Yeah, patients come back
You
in.
could see it in the pictures.
Yeah,
patients come back in for their second treatment. They're just like, that swelling. Am I going to get the same swelling?
Yeah.
Typically, the second time around or the third time is not as bad as the first initial post-treatment swelling.
Oh,
but
so
it's still
do this when you're listening in. People, listen to me. Do this when you have 3 days to stay home or not worry about it or wear turtlenecks or whatever. The worst thing you could do is go in and then go out the next day thinking you're going to look fabulous, right? Your 2 chins will now be 4.
Exactly.
So, yeah, you got to give this some time. Time.
Yeah, and also just for people to know that Kybella, it's meant for the submental fat, but if we find or if people have little pockets of fat, we can actually treat it that way too. And we've had really good results with that, for instance.
So what other areas can you use
so the
it
little
on?
area that we have, it's not a bra roll. I don't even know what
I know what that
this
little
fatty
chicken fat that's right at the top where your arm meets your
the smaller
breast,
pockets of fat. We've also had a patient who had a small bulge on her outer thigh, didn't want to go through lipo for it. So we started treating the bulge on her thigh. It was just a tiny area, but I think we did 3 sessions for her for that.
Art, I have a question, and I think I know the answer, but what about the fat deposits under your eye when you hit? Is that too sensitive an area for Kybella?
Yeah, that needs more control. So something like surgical, what Dr. Berkowitz does.
Yeah,
to
you
remove
probably
it.
have to remove that pocket of fat.
You have to be very careful with that area.
Yeah, see, I think under the eyes is probably one of the most delicate parts of your face.
Yeah.
So you want to be really careful. Even with products that you put under your eye, you don't want to use the real drying things like the retin-A's. Now, the product that we had on before, Jamie, that Julie mentioned for under the eyes, that's a good one.
The Regenica.
Yeah, the Regenica is good. You like that one?
I like that eye cream, yes.
Okay. Now, with eye cream, do you use it on top of your serums and moisturizers, or do you use that separate and then put the other stuff, other parts of your skin? I always wondered, do you treat the eye area separately?
You should treat the eye area separately, yeah. You'd have to find out, depends on the serum you're using. It may be able to be used under the eye, some can't be, but eye cream should just go on its own.
So you should use eye cream around the eyes and all the other tighteners and moisturizers on the rest of your face.
It's such a delicate area, like you said. So.
This is like a real procedure here, guys. I mean, you have to really spot check your whole face.
Even applying the way you apply eye cream, you're supposed to use your ring finger because it's the weakest finger. So
and you just pat it.
Yeah.
You don't rub it in.
Yeah.
But your other moisturizers, you kind of rub in and smooth. So you really have to take care of that area under your eye. Now, in your opinion, does Botox in the corners help reduce some of those little wrinkles on the side of the eye?
Oh, absolutely. Botox is great. It's my favorite product, but it's really good for under the or around the eyes. Directly underneath the eye, you can only inject it so far in, but it'll soften.
Aren't
the
there
rest.
other certain products? I don't know if it's Juvederm or what's the other one? Tesla.
Bellatero, maybe.
And there's Versa, right?
Versa.
So
yeah.
some of the other products are better to be injected under the eye in that tissue.
Yeah, because it's
that's
a thin area, so you need a very thin filler to use under that area too.
okay. So the consistency of it has to be so fine that it comes in a teeny little needle.
Basically.
Some of them are thicker, right? And they need a bigger needle.
It's more like the product itself is going to look too heavy under the eye,
Or it could
it'll
lump
show
up or
through
something.
lump up. Yes.
Yeah, right. This is all important stuff
It
because
is.
we all want to look as good as we can, and fillers are very important nowadays. I mean, it seems like everybody I know gets fillers over the age of 50, even younger, correct?
Oh, yeah, absolutely. 20s.
Now,
30s.
why would a beautiful girl in her 20s need fillers to fill what?
Well, I mean, some people just have genetic reasons for it. For instance, hollowness under the eye or dark circles.
I mean, I
or
was
even
just telling Sylvia the other day, I actually had sent her a side-by-side myself, like before I started here, and then now post-second baby. I was looking at this, I was like, oh my God, I text Sylvia right away. I'm like, Sylvia, filler, and my nasolabial fold, ASAP. Or I'm
and
cheek
it's really
area.
for Danielle. It's 2 pregnancies later, she's lost volume in her face. So when you lose that kind of volume, you want to restore it, and you restore it with filler.
I never really thought that girls started in their 20s. But I look at you all, and you all don't have a line on your faces, not a single line. Your foreheads are like landing fields. You could put a plane on them.
Landing field.
Seriously, there's not.
That's a great compliment.
I mean,
Jackie.
they're awesome. I mean, it's just unbelievable. I mean, you look at people who have these perfect faces. They look like a doll. You know, there's not a mark on it, not a discoloration, not a line. And that's attainable, I guess, if you start young and start layering the products, and you always look that good. But what do you do for a person that comes in and they're 60 years old and they have sun damage, they have older skin, they have a lot of lines, they have their lines on their forehead and the little 11 there right in the middle of their nose and eyebrows? And where do you start?
Well, you take like a multi-faceted approach. Like you have to take care of the volume, but you also have to take care of the skin. So that's where Josh would come in. If it's something surgical, obviously Dr. Berkowitz. So sometimes you do have to
you have to start with realistic expectations.
Yeah,
you know?
and just throw in a package and tell them.
And really just like, and a lot of it too, I mean, like you had mentioned earlier, price point. How far are you willing to go? And like, if it's that important to you, are you really willing to spend that extra money on going the surgical?
Are there certain procedures? I know if your upper lids are preventing you from seeing clearly and reading, that's covered. By insurance.
Usually that's covered.
Okay, so are there any other procedures that any of you do that are covered by insurance?
No, I don't
Typically,
think so. No.
See, that's the problem with healthcare in this country. I think look at Brazil. Brazil, the government pays for everything, right? Anything you do plastic surgery, the government will pay for it.
Oh God, I think we would be on like a 5-year waiting list.
I mean, they want their people to be the most beautiful in the world, and they will. You could take your babies in and get their noses fixed, I heard. I don't know if it's really that young, but it's a very, very cosmetically conscious country, and they support that.
Jeez, I need to move to Brazil.
That's what I'm saying, right? A great place to move when you get older, just even for 6 months.
Absolutely.
Right. Get it all done and come
Get
back,
your residency
right?
in.
All right, so Sylvia, you brought a product in.
I did,
And I want to know what it is because I'm just getting filled with all this good information on all these products. So is that a sample?
So
obviously not. Okay.
So
tell me about this.
So it's with our product.
Put it on
line.
my wish list.
So Elastin is the product line, and I brought this. It's the restorative neck complex. And since we were speaking about Kybella, some patients come in, especially our older patients. They feel like if we remove some of that fatty tissue, they're just going to have loose, saggy skin. And depending on the person, some people have already some loose skin, so I would be cautious about treating their neck with Kybella because it could cause that. But most people they're fine with it. It's not an issue. But when they still have kind of an insecurity about the laxity of their skin, this is a great product. It's with the trihex technology, which Alastin, all their products have. It's going to build collagen. It's going to tighten the skin. It's going to hydrate the neck. So it's specifically made for the skin of the neck.
And you put this on at night and in the morning?
You can put it morning and night, correct.
And it will help tighten up your neck?
Yes.
Oh, well, this
it's a great complement to use to a treatment like Kybella, or just if you want some.
Okay, so if you can't afford the Kybella or are afraid of the pain or the discomfort or whatever, this will still help you, right?
With
hurt.
tightness. Okay, so Kybella is not tightening.
Right, it just removes
the fat. Yeah,
but this will tighten what's there.
Yes, absolutely.
And did you tell us how much this is yet? Do we know the price on this one here?
I don't even know.
I think
this is around $250.
Oh, this is a pricey one here. So this must really work on the neck. If it's for $250, I would think this works really well, right? So
it does.
It really does.
So you've seen befores and afters of people that have been doing this. So how much time does it take normally till you would see results from the tightening?
I mean, any skin product, I feel like you would a month. I would
You have
say
to give
at
it
least a month, at least to see some
so
results.
you can't just do something and then the next day walk outside and say, "Wow, look at the difference." Like anything else, it's going to take time for your skin to accept it, soak it in.
It's turning over. It's creating new cells. So yeah, it takes about a month to see some
And how
changes.
long will this size last you typically? If you use it twice a day, what would you say you can get out of this?
I mean, I would say you could probably get easily at least a good 2-3 months out of it.
3 months, I would say.
You
yeah,
know,
for
you
sure.
don't need a lot of product.
No.
A little bit goes a long way.
Okay.
It's nice. It comes with a pump, so no digging of fingers
Oh,
into
that's
a jar.
what I like. Yeah, especially when you have nails.
Yes,
It all
and then you
gets
don't
under
know
your
which way to go with
right.
it.
You have to use the back of your thumb to
Exactly.
scoop it out. Yeah, so that's
messy.
great. That's a good product. And does this company have other products also besides this one, or is this their go-to product?
No, they have a whole line of products from eye creams to face moisturizers.
So again, we're back to the eye creams. So which, in your opinion, everybody has their favorite products here. What's your favorite eye cream?
I just started using I've loved the Regenic eye cream. I just started using the Alastin eye cream maybe about 2 weeks ago. So I can't really say for sure, but it's hydrating. It's really nice. I like a dewy, hydrated eye area. So they both provide that. I just have only used this for about 2 weeks, so I wouldn't really be able to say.
Now, have you all done that Hydra Facial? All of you have had that? Now, how often can you get that?
I mean, depending on, you know, how deep and how aggressive we go, I do it for patients, you know, anywhere from twice a week, like once every 2 weeks to maybe once a month.
Okay, so once a month is a good period to space them
Absolutely.
out and get that kind of skin that you want. And then when you come in for the Hydra Facial, will you then analyze their skin at the same time and tell them what products are good?
Absolutely, every single time. Any patient who comes in for skincare concerns, I always like to treat them like it's the first time they're coming in, even if I've been seeing them for years.
Okay, because there's changes in our skin.
Exactly. You
Whether
know?
from the environment or from pregnancy or
What
from
does their skin
stress.
look like that day? That's what I'm treating, is how their skin looks that day.
That's great.
So yeah, absolutely. Every time I want to talk about, you know, what kind of products you're using. How's your skin doing? Is it dry? Is it oily? You know, are you experiencing any type of breakouts? You know, is anything going on in your life that may cause, you know, flare-ups of rosacea or, you know, whatever it may be.
So do these facials help with rosacea and things like that, or do you need other products for when you have discoloration, you know, and rosacea is red blotches, and you can get them wherever. What's the best thing for that?
You know, I don't think Hydra Facials are the best thing for that personally. I think something like IPL is amazing along with great skincare. I've seen incredible results with rosacea from doing a combination of those things.
Okay, because basically that's kind of harder to cover with makeup if you have a lot of that redness, you know, and you have to learn all the different colors, because I learned that there's different colors to cover different things. Like there's the green tints and there's the yellows for different kinds of bruising. So that's a whole other show of how to
the color wheel.
The color wheel, And you know, some people have more pink in their skin, some have more yellow in their skin, and so on. So you analyze that as well, correct?
Absolutely.
So you'll tell them what tones they have and undertones. See, all of that stuff is so important. Just even if you're not getting any procedure done but a facial, at least you'll know what the right makeup and skin products are for your skin.
Absolutely.
I love this, and I think every woman and men too. Do you do a lot of men as well?
Of course.
Oh yeah.
Yeah, I would say the number of men,
Has
male
increased over
patients.
the
Oh,
years.
absolutely.
I
It's
love
crazy.
that. I love those metrosexual men.
All right.
Doctor, my eyes have seen the years.
Well, I hope you found that interesting. I did. I learned something every week. We're going to be back next week and get to the rest of your questions, or at least as many of them as we can. So stay beautiful, and we'll see you back here with Dr. Berkowitz in 1 week.
Doctor, my eyes